I'm John McIlveen. I work for the Oregon Health Authority's Health System Division, and I'm the State Opioid Treatment Authority for the state of Oregon. We are here today with my colleagues Ashley and Kelsey, and I'll let them introduce themselves again and tell you about their role. We are here to talk a little bit about state opioid response updates. One thing that, another role that I serve along with being the State Opioid Treatment Authority is also working with Kelsey as the project director and myself as the principal investigator of Oregon's State Opioid Response Grant. So what we wanted to do was talk to you a little bit about that, have some focus on the youth activities, things that might touch on youth issues. I also want to talk a little bit about, at a really high level, some dynamics around the changing landscape with fentanyl and how that impacts youth. Ashley's also going to talk a little bit about the Save Lives Oregon project, and with kind of a youth emphasis or highlighting some youth-focused things. But really, it's really about kind of giving you guys an example, a little bit of information about this grant and this work that we do that really is one of the flagship federal grant funding streams to address opioid use and misuse throughout the country and all the jurisdictions of the U.S. So, I will pass it on to Kelsey and Ashley so they can briefly introduce themselves again. Oh, and you guys have one, okay. We have so many microphones up here, Bernardino, this is great.
Hi, everyone. Kelsey Payne, obviously work for Oregon Health Authority in Behavioral Health Unit. I'm the project director for the State Opioid Response Grant, also known as SOR or SOAR, which you'll be hearing a lot more about in a second.
Hi, everyone. Good afternoon. I apologize. My voice is a little raspy today. My name's Ashley Jones. I work with Kelsey and John at OHA specifically on the Save Lives Oregon and Or Salvando Vidas Oregon initiative, which is one of the initiatives funded under the SOR grant, and I'll talk more about that in just a few slides.
All right, thanks, Ashley and Kelsey. So again, we'll start out, this is a diagram that we put together. Actually, one of our colleagues, I think, was the main driver in that. Jude, right? We give her credit for this little slide thing, so she deserves it. But it's kind of a great graphic that really describes the different aspects of the SOAR grant. The SOAR grant, again, is a grant authorized directly from Congress to SAMHSA and then out to the different states to mitigate opioid use and misuse. And in the fourth iteration of the State Opioid Response Grant, or SOAR, what we were trying to do is employ a comprehensive substance abuse prevention service plan, strengthen overdose prevention, harm reduction resources, increase access to treatment and recovery support services, and expand the substance use disorder workforce in the state. And I'll let Kelsey kind of dive into a little bit more of the details when we go into the SOAR overview, but that's just kind of to give you a very brief high-level picture of what SOAR looks like. So what's the context for this? I think all of you working in prevention and related youth interventions and activities are really well aware, as I think most Oregonians are, of the terrible toll that fentanyl is taking on our communities. Oregon is experiencing an unprecedented rise, and exponential, as you can see, since 2019 in fentanyl and fentanyl-related deaths. We also are in a time where we also are looking at significant polysubstance use, very lethal, highly potent drugs available in virtually every community in Oregon. When we talk about the SOAR grant, and even we focus on some of the different youth things that we'll touch on, the SOAR grant and activities that are associated with it really are the basis, are really rooted in evidence-based and other practices, working directly with communities and community-based organizations to try to mitigate the impact of that. As you can see, obviously, by this slide, the rise in death related to fentanyl is incredibly high in Oregon. One really interesting statistic is that about 90% of opioid deaths are due to fentanyl in Oregon. So that is an incredibly high number. It is among the highest in the country for percentage of that, and Oregon's also experiencing one of the greatest rises in fentanyl death year by year since 2019. That also goes for the youth population as well. The CDC estimated about a 600% increase in youth overdose death due to fentanyl since 2019. And again, a lot of that has to do really with the dynamics. Youth have a history, and a lot of people have experienced this about experimentation, and that's part of a thing that you do in youth. The real problematic issue here is the lethality and potency of these drugs, in that there's not much room for error. So I think I'm going to pass it to Kelsey so she can talk a little bit more about the SOAR, and I'll also chime in with some information about youth and things like medication-assisted treatment, which remains to be the gold standard for the treatment of opioid use disorder. So, Kelsey, I'll turn it over to you.
Should I get up?
Sure, go ahead. We'll trade seats.
Sorry. I feel more comfortable sitting, but let's see here. I guess I have to move my slide, so I have to stand. So just want to just say for context too, obviously today we're just going to be speaking about the SOR grant. That's just a sliver of what we're doing at OHA. Obviously there's the suicide prevention. By the way, that was an amazing presentation. It's kind of hard to go after that. But at least we wanted to just share at least, just kind of for context, how we're trying to partner with you all, and how, kind of the whole sort of system is sort of coming together. So again, a little bit background on SOR. So as John mentioned, SOR is a grant that we've been getting for the last 5 years from SAMHSA. It is non-competitive. All states get it as long as you apply. And what I love about the grant is it is really to address the opioid crisis and now stimulants as well across the continuum. So we're definitely focusing on use, misuse prevention, harm reduction, treatment, recovery support services. Workforce is not a requirement, but in our opinion, it's very important. So we're doing just a few things around that I'll share a little bit more about in a second. So just sort of very briefly, kind of just share about some of the prevention activities. So we have been working with Department of Education for the last couple of years, working on some school-based prevention programs. It's a very small program, but we've been working on creating curriculum for high school age. Currently, we're working on middle school curriculum. It is all open source. I probably should have put that link in here, but working on that. And then the second part of that is to work with a couple school districts on developing their ATOD, their alcohol and other drug plans. There's the Youth Advisory Council, which started in this last year, really, uplifting youth voice, talking, pretty much anything behavioral health, whatever it is that the youth are saying is a concern or of interest to them, and really working on policy considerations. The community coordination is we've been funding overdose prevention coordinators in 11 regions in the state. That is not going to be funded out of SOR anymore, but it is funded through another source. And then the healthcare workforce training, not sure if any of you have heard of the substance use echoes. There are, 14 of them at this point. Those are online, sort of didactic type sort of training resources, typically for the medical profession, or for the medical profession, but they have ones like SUD leadership echo, SUD in hospital care, SUD in ambulatory care. There's a SUD in jails. So really trying to bring that education piece to both our medical community and some other different kind of target areas. I won't speak too much about the harm reduction activities. Ashley's going to speak a lot about Save Lives Oregon. That's one of our largest initiatives and probably has had one of the largest impacts. I will speak a little bit about Prime Plus, but I could speak about that for an hour plus. But Prime Plus, if you haven't heard of it, is peer recovery initiated in medical establishments. And then the plus is connection to testing and treatment for infectious diseases. And really this started during COVID. is really trying to bring harm reduction peers out into the community. So not just long-term recovery services, but really meeting folks where they're at, whether or not they want to stop using or not. We have over 80 peers as part of that, all across the state. Is one of our most impactful programs. Again, I'm just giving you just a little sliver of things, but again, feel free to reach out to me if you want more information about any of these. Main target of the grant is really to expand access to treatment for opioid use disorder and stimulant use disorder. So with that, we've been increasing access to medication-assisted treatment, MAT, both through opening new opioid treatment programs or office-based MAT programs, or expanding those services. And of course, improving care transitions. I think we've assisted opening 7 new opioid treatment programs. For those that aren't familiar, opioid treatment programs are methadone and buprenorphine clinics, so they're a little bit different than some of your other MAT programs. This is a new slide. John, I think you're going to speak to this one.
That's fine. I can do that. Thanks, Kelsey. So just a quick kind of talk about youth and MAT. I talked a little bit about the prevalence, the rising rates of mortality among youth in Oregon and unfortunately nationwide. I will say that if we look at trends and patterns, Oregon has one of the steepest increases, but it's not alone. This is an issue that is right now currently most acutely impacting the West. So Oregon, Washington, California, Nevada, Arizona. And so that's just, a lot of data that we're showing. We're seeing much greater levels of saturation of fentanyl within the communities in the West Coast and in the Pacific Coast. Higher levels of mortality from overdose and the like, and more non-lethal overdoses as well, compared to many other parts of the country, which has really had a disproportionate impact in compared to previous years on youth and young people. When I say the changing paradigm around substance use severity and the age of fentanyl, what I'm really talking about is, so a lot of my work as SOTA and our work together on the grants do, as Kelsey mentioned, have a lot to do with expansion of MAT and treatment services. Why is fentanyl so different? Well, you've heard, I talked about a little bit, but you've probably heard in the media or seen things or read or whatever. Highly potent, very available, extremely cheap. How does that relate to youth, though? I talked a little bit about the experimentation aspect of it and that factor, which is obviously a key role in the mortality rate associated with it. But when we talk about actual treatment access, there's a couple things that I think are important to think about, and this is why I say a changing paradigm. Because of that potency and the development of tolerance and dependency on fentanyl so fast, and illicitly manufactured fentanyl, opioid analogs, we're seeing younger people who are fitting like diagnostic criteria to enter medication-assisted treatment programs that we didn't see before. So what traditionally would take several years to develop, not to be too clinical or cold about it, to develop that level of a substance use disorder or opioid use disorder in particular, we're starting to see individuals in their teens, they're developing really significantly severe physical dependencies on opioids. That's what makes it really crucial because, MAT has always been effective in youth populations. And I think just being very honest, again, we didn't see it as much. And a lot of that was due to drugs and drug use patterns because, 15, 16-year-olds, and there has been intergenerational drug use for a long time in this state and in other places. However, we're seeing this level of dependency and tolerance in kids that are just much, much younger. And what used to take 2, 3, 4 years to develop a really severe OUD, we're seeing teenagers develop that at 15 and 16. We're seeing teenagers come to the opioid treatment programs looking for help. So I think, it's just something we need to think about system-wise, and how are we going to adapt to that. And and I'll say one more thing about that. Tony kind of mentioned when he was talking about, more in the context of recovery work and peer work and kind of the differences in spaces for adolescents as opposed to adults. That same analogy really holds true for treatment too, or the settings in which youth are going to access treatment. A lot of times, an opioid treatment program is really set up for adults, right? Even in terms of the programming and the curricula, it's going to be set up for a differing population. So I think that's something that we need to think about, because we can get youth access to medicine fairly easy, and I'll talk about some of the basic legal constructs around that. But what is going to be more challenging is for us to figure out a structure of care and counseling and other services that are going to support. And it is part of the continuum, and just like he was talking about before, recovery services, and I think we're going to talk a little bit about that when it comes to youth in a few minutes, but those are going to be crucial there too, but they all kind of have to work in tandem. And now, unfortunately, we have gaps in our ability to provide those services to youth in a seamless manner. Legally, you have to be 18 without parental consent to receive methadone as treatment, which is in Oregon revised statute. For others, it's 15 or 16 for buprenorphine. There are, and there is a difference there. There was a piece of legislation, 2395, which passed in other versions, other iterations. It was included or proposed to reduce that age. That did not become part of the final bill. That bill, 2395, some of you may have heard it referred to as the opioid omnibus bill. So that was removed from that. But so it's still 18 for methadone. And again, I talked a little bit about care transitions, and really the need for us really to focus on figuring out spaces, and again, just like the talk earlier, really what type of care transitions do we need to have for children that are involved in the criminal justice system. This is something, and our child and family colleagues can attest to this. We are getting contacted about different situations, and I've been asked to consult on different things at a more rapid level than I can ever remember with this population and opioids. So, it's anecdote, and we have facts behind this too, but, in terms of the numbers and the mortality. So yeah, and just looking at that and how do we continue to build the system, I think this is the beginning of a conversation as opposed to the end. So these are all just kind of considerations we want to think about.
Awesome, thanks, John. So I'm going to talk a little bit about the recovery support activities, and again, just hopefully to see, you guys heard from a couple of the programs that the SOR grant funds, so try to just at least give you a little bit of a perspective on some things that the state is doing to try to support the work. It is really incredibly important to myself and my team that we increase access to recovery support services. So for the last 5 years, we've been supporting an expansion of I don't know why I'm looking over here. I should just look over here. Sorry. Expanding recovery support programs for Latinx, Black, LGBTQIA+, tribal, and young adult populations such as, I'm totally blanking right now, Northwest Instituto Latino, Painted Horse Recovery, True Colors Recovery, and the program that you all heard of, 40s Youth Adolescent Program, Adolescent Recovery Program. Also the beautiful Oregon's Recovery, First Recovery High School, Harmony Academy. SOR supported that work and continues to support. And we also have a goal in our funding, expanding recovery wellness programs and recovery gym models, such as the Recovery Gym in Portland. I will touch on some of the SUD workforce activities. A couple of these we've actually passed on to our workforce unit, which is great. It's getting funding just from a different division. But what we started with the grant was supporting registration and certification for CRMs and CADCs. So either if you're renewing or getting your certification, there should not be a fee. That is still going on. So get the word out there. That was also incredibly impactful. We saw the rates. We saw a lot of new folks and a lot of folks that had been in the field renew their applications when that went into effect. We've also been increasing peer certifications in both English and Spanish. There's been a lot more Spanish CRM trainings over the last 2 years, which is incredibly needed. Another one, it's called the ETC program, Education Towards CADC, which is targeting rural and frontier communities, giving all of the CADC educational opportunities to folks that are trying to get their CADC. So we've served, or we've, let's see, over I think 100 people now have gone through that training. We've had 4 of them in the last 2 years, and then currently 3 are going on, and then we've got 3 more next year. I think I overheard somebody mention that one earlier. And then, as I already mentioned, the Project Echoes for rural and frontier providers. And I have no idea what time we're at, but I'm on my last slide here, just a little bit of outcomes, and also just a little slide that shows you, or a little snippet that shows you kind of the different iterations of the SOR grant and how much funding we got. But as you can see, we've served over 350,000 Oregonians over the last 5 years. About 10,000 of those were for medications, so MAT. One thing I didn't mention is SAMHSA added for us to be able to address stimulants over the last 2 years, so we've been doing some contingency management work. Our recovery programs have rocked it, serving over 12,000 individuals. And then our Prime Plus work has served almost 5,000 folks. I do have some naloxone information here. So SOR initially, a couple years ago, was funding naloxone, but the need outgrew what we had funding for, which is what turned into Save Lives Oregon, which I'll let Ashley talk about. If you have, I know that was just a really small snippet, but if any of you have questions about any of the different programmings, if you have ideas about stuff, please feel free to reach out. I love talking about it, so. Yeah.
Microphones. All right. Hi, everyone. So like I mentioned before, my name is Ashley Jones, and I work primarily on the Save Lives Oregon, or Salvando Vidas Oregon initiative, which is one of the initiatives that Kelsey mentioned earlier, part of the SOR grant. This is a model that actually you may have seen on one of the earlier slides, and it really talks about harm reduction strategies specifically, and how harm reduction fits within the continuum of care for substance use disorders. Harm reduction is a critical element in the continuum of care, and it is what we prioritize through the Save Lives Oregon, or Salvando Vidas Oregon initiative. The goals of the initiative are really to provide equitable access to supplies and resources for organizations across the state who are directly working with people who are at highest risk of overdose, infection, and/or injury due to substance use. For partner organizations, this collaboration really looks like technical assistance to help move them from awareness of harm reduction to partnership in harm reduction activities. The Save Lives Oregon initiative also provides communication toolkits and other resources that help agencies learn how to advocate for harm reduction within their agencies and within their communities. And then, of course, well, maybe not, might not be of course to you all yet, but to us, we provide supplies through the Save Lives Oregon Initiative, harm reduction supplies that specifically work to prevent overdose, infection, and injury due to substance use. We don't do this alone, though. The Save Lives Oregon Initiative is a collaborative effort between the Oregon Health Authority, and we have a leadership team comprised of 10 community and tribal-based organizations. You might see their logos right there. And together, we work to build out this initiative and spread the word across the state. It is truly a community-led and community-driven initiative, which is a pretty amazing piece of work. This paragraph on this slide is actually taken directly from the mission statement that our leadership team developed. We do this. We support people who use drugs by activating our networks and sharing our expertise with organizations best positioned to expand the Save Lives Oregon or Salvanda Vidas Oregon harm reduction initiative across Oregon and Native communities, guiding them from awareness to partnership. One of the pieces of the Save Lives Oregon initiative is the Harm Reduction Clearinghouse. And this is a project that is really focused on equitably distributing critical harm reduction supplies to agencies that are directly serving the highest risk population, so people who are at highest risk of overdose, infection, and injury due to substance use. These supplies are at no cost to the agency, and they include, we have well over 200 supplies that are available through the clearinghouse. And I'll go over the breakdown of what is primarily ordered, but largely naloxone. Naloxone is really the main harm reduction supply that we get out at no cost to participating agencies. The organization types include everything from health clinics, community-based organizations, tribal service providers. We have local public health authorities. We also have uniformed first responders, so EMS, police, sheriff, firefighters, prisons, parole and probation, substance use disorder treatment facilities. The list goes on, truly. Here is a map that shows the breakdown of the current agencies that are participating in the Harm Reduction Clearinghouse project. So these are the organizations that are receiving the no-cost supplies across the state. We currently, or as of yesterday, we have 261 agencies participating in this project, so receiving supplies at no cost. 108 of them represent community and tribal organizations and programs, 20 substance use disorder facilities, 44 syringe service or harm reduction programs, 18 health clinics, 36 uniform first responder agencies, and then we have 35 special districts. I will mention at this point that our project is in the middle of an expansion too, so we recently brought on special districts. We are working very hard to roll out our expansion into schools and universities. And then lastly, probably the beginning part of 2024, we will also open it up for public building spaces. So again, just really trying to get out supplies, harm reduction supplies, to communities as comprehensively as possible. I will also mention that of the 261 organizations that are receiving supplies, 85% of them, if not more, are engaging with people 18 years and above. We probably have about 20 to 30 organizations that are youth-facing, adolescent-facing agencies. So we do welcome agencies that are serving a wide variety of ages. And this is my call to action to all of you. If your agency is actively interacting with young adults and you need supplies to make sure that they can keep themselves and their peers safe, please look up Save Lives Oregon, savelivesOregon.org, and check out our project. A couple more slides. This one, really, really exciting statistic. Since January 1st of 2022 through September 6th of 2023, Save Lives Oregon has facilitated the distribution of 300,000 doses of naloxone across the state. Yeah. This graph shows the broad spending categories of the supplies that we get out. So the vast majority of the spending goes towards naloxone, 86%. We do also offer sharps containers, sterile syringes, wound care supplies, hygiene supplies. And you can see the breakdown for those other categories on the slide. For those of you that are interested in either applying on behalf of your agency or sharing this information with other agencies, this is the process to applying to receive supplies from the Harm Reduction Clearinghouse Project. Really, the biggest takeaway from this slide is our application is online at www.savelivesOregon.org/apply-form. We welcome, we get new applications every day. And that concludes my portion. Thank you all very much.
Does anybody have questions? I think we're maybe a couple minutes ahead, Bernardino, but we were
yeah, absolutely.
started a few minutes early.
Thank you so much. That's great information.
Great, thank
any
you.
questions for our panel? I have a question here.
Hi, thank you. Just quickly curious, you mentioned that you're expanding for to provide services to schools. So would you recommend, I work in the school, jumpstarting that and sharing this info, or do you have an initiative to reach all schools once you're prepared for that capacity?
Great question. So we are working with our partners in ODE to make sure that they can share the information out through their listserv. I would say that it's never a bad idea to share our project with other partners. Just know that on the website right now there is not a mechanism to apply for schools. Our hope is that when it's up and running in the next month, fingers crossed, that announcement will go out through ODE as well as the School Nurses Association. So keep your eye out.
You had a slide that showed 300,000 naloxone kits distributed. Do you have any way of tracking how many have been used to save lives?
That's a great question. So we do not require that our agencies report out on use. We offer the option. We do have a reporting form where we ask agencies to report out the number of doses distributed per month. There is an optional section at the bottom of that form where they can share community-reported overdose reversals or staff-reported overdose reversals, although at this point, we do not require that they collect that information. I will say, though, that just voluntarily, I think, my memory serves me, just anecdotal and unrequired sharing of that information, over 5,000 reversals were reported to us in 2022. So that's just the tip of the iceberg, I'm sure.
I would just add to what Ashley said. You know, number one, the idea behind the clearinghouse and Save Lives Oregon is we're going to reduce the barrier to people accessing. And the more requirements you have, I mean, obviously we want to track the overall doses, and we're using, you know, we were just allotted money from the Opioid Settlement Board. You know, we needs continue to need resources for Save Lives Oregon and for the clearinghouse. But yeah, it's about lowering the barrier, and I think also just if you put thousands of reversals, like Ashley said, you know, kind of self-reported, that really has had a tremendous impact. It's really difficult when we have these, what look very catastrophic numbers in terms of overdose. And I like to say, you know, to use the term that the net is getting wider, you know, impacting younger people, impacting more diverse communities in Oregon. That naloxone has definitely, as bleak as things look, and they don't look great right now, in terms of mortality related to opioids, naloxone has saved thousands of lives that's been distributed by the clearinghouse, and that's a wonderful thing, and it has made a difference. Just because things aren't going down right now, it doesn't mean that there's not individuals and people who have been saved in your communities. You might even know some, you know, that have been saved by naloxone that came from the clearinghouse. So.
Hi, I'm a mental health counselor and a drug and alcohol counselor in private practice, and I was wondering if you guys help people in private practice at all.
In what context specifically?
Yeah. Well, I'm just an individual providing mental health and drug and alcohol counseling myself, sure. But looking to possibly have employees underneath me or to expand to provide more services. Do you guys at all help people do that? Does that make sense?
I think so. You're talking about like kind of expanding a business because of and doing services. But I mean, yeah. we work with people through our grant work that we've done for years. We work with people all over the state and organizations, and you know, I think there are, you know, I think when you think about things like workforce, there's different. You know, one thing that I think that we can do or do well, I think at the state, is we can be a resource, right? We can be a resource to get information, and like Kelsey and Ashley said, feel free to, you know, reach out to us if you have questions or want to be directed in a certain way. One of the, I think, like I said, strong points is that we have kind of that ability to be able to go different places and talk to different people and have relationships with a lot of people around the state, which I think can help be a resource. So yeah, feel free to reach out.
Okay, thank you.
Sure.
If not, I just want to say much appreciation, respect for all the work that you're doing. We're all in this together. And so just thanks for letting us present.
Yeah, thank you very much, Dr. McIlveen and Kelsey Payne and Ashley Jones. Thank you so much. Great information. Thank you. Oh, thank you. So now, I guess I'll get it. Okay, cool. Okay, so I'm gonna look for the QR code. Give me one sec here. There it is. It should. I hope it works. Can you let me know if it did work for you, somebody? It did. Okay, great. Thank you. So yeah, so thank you very much. This is the QR code. If you can just scan it if you're able to. If you're not able to, please let me know. And then I'll email you a link. But anyway, I think for final, we ended up a little early, but that's okay because it's Friday. I just wanted to end with a couple comments. You know, I felt, you know, I mean, I feel really grateful for having the opportunity to not only be in this position, but be able to have some available funds to be able to do a project like this that came out of the community's voice, the importance of prevention and recovery that's been so neglected for so many years. I think we are, one of the things that I said when brought together the collaborative. I did get a lot of criticisms of like, oh, nothing's going to happen. OHA never does anything. And I said, no, I said, if I get this position, I said, it's about action. We're going to do something. And this is a result of the community feedback and the start of the actions that are being taken by OHA in the state of Oregon to make it better for youths and young adults and for adults, for the lifespan. And so I'm really grateful for that. I'm grateful for all of you making the time and energy to come and join us here today. Some of you traveling from afar. Thank you for registering, for participating, for the presenters, for the volunteers, for U of O, College of Education, for the staff that helped put together this event. And so I'm, there's nothing but gratitude. And there's been a lot of work by many of us and the work by the presenters as well. So I want to thank you all. And I also wish that you all journey back home safely and enjoy your weekend. And I just want to say thank you very much for everyone for being here.